Welcome to Physical Education for SS1 at Light Tech Academy. Today we study anatomy and physiology, the skeletal system. What is anatomy and physiology? Anatomy is the study of the structure of the human body, the names, locations, and forms of body parts. Physiology is the study of the functions of those body parts, how they work and interact. Understanding the skeletal system is essential for physical education students because it explains how the body moves during exercise and sport. It helps prevent injuries by understanding bone vulnerability. It explains the relationship between exercise and bone health. It forms the foundation for understanding muscles, joints, and movement. The human skeletal system. The human skeleton contains 206 bones in the adult body. At birth, babies have approximately 270 to 300 bones, many fused together during childhood and adolescence. Functions of the skeleton. 1. Support. The skeleton provides the framework that supports the body. Without bones, the body would collapse. 2. Protection. Bones protect vital organs. Skull protects the brain. Ribcage, thoracic cage, protects the heart and lungs. Vertebral column, spine, protects the spinal cord. Pelvis protects the reproductive organs and lower digestive organs. 3. Movement. Bones act as levers, muscles attached to bones pull them to produce movement, joints are the fulcrums. 4. Blood cell production. Hematopoiesis. Red bone marrow, found in the medullary cavity of flat and irregular bones, produces red blood cells, white blood cells, and platelets. 5. Mineral storage. Bones store calcium, 99% of body's calcium, and phosphorus. These are released into the blood when needed. 6. Energy storage. Yellow bone marrow, fat, stores energy reserves. Types of bones. 1. Long bones, longer than wide, have a shaft, diaphysis, and two ends, epiphyses, e.g., femur, thigh, humerus, upper arm, tibia, fibula, radius, ulna, contain yellow marrow, primary lever bones for movement. 2. Short bones, roughly cube-shaped, e.g., carpals, wrist, tarsals, ankle, provide strength and stability, minimum movement. 3. Flat bones, thin, flat, slightly curved, e.g., skull, sternum, ribs, scapula, protect organs, contain red marrow, blood cell production. 4. Irregular bones, complex shapes, e.g., vertebrae, sacrum, coccyx, some facial bones. 5. Sesamoid bones, small bones embedded in tendons, e.g., patella, kneecap, protect tendons from wear. Structure of a long bone. Epiphysis, the two ends of the bone, covered with articular cartilage, smooth hyaline cartilage for joint surfaces. Diaphysis, the shaft, main body, of the bone. Medullary cavity, hollow central canal containing yellow bone marrow, fat, in adults. Periosteum, dense fibrous membrane covering the outer surface of bone, except at joints, contains blood vessels and nerve endings, involved in bone growth and repair. Endosteum, thin membrane lining the inner surface of the medullary cavity. Compact bone, cortical bone dense outer layer, makes up 80% of total bone mass, organized into OST-ONS, Haversian systems, provides strength. Spongy bone, cancellous bone inner, lighter lattice-like structure, contains red bone marrow in flat bones and epiphyses, absorb shock. Epiphyseal plate, growth plate in growing children, cartilage where bone elongation occurs, fuses into epiphyseal line in adults, completed 18-21 years. Bone composition. Inorganic minerals, 70% mainly calcium phosphate and hydroxyapatite, give bone hardness and rigidity. Organic material, 30% mainly collagen fibers, give bone flexibility and tensile strength, prevent brittle fractures. The axial skeleton, 80 bones, forms the central axis of the body. 1. Skull, 22 bones. Cranium, 8 bones, protects brain, frontal, parietal X2, temporal X2, occipital, sphenoid, ethmoid, facial bones, 14 bones, mandible, maxilla, etc. 2. Vertebral column, spine, 26 bones. Cervical, 7 vertebrae, C1, C7, neck, C1 equals atlas, supports skull, C2 equals axis, enables rotation. Thoracic, 12 vertebrae, T1, T12, chest, attached to ribs. Lumbar, 5 vertebrae, L1, L5, lower back, largest vertebrae, bear most weight. Sacrum, 5 fused vertebrae, connects spine to pelvis. Coccyx, tailbone 4 fused vertebrae. Natural curves, lordosis, cervical plus lumbar, concave anteriorly, kyphosis, thoracic plus sacral, convex posteriorly. 3. Thoracic cage, rib cage, 25 bones. Sternum, breastbone, manubrium plus body plus xiphoid process. 12 pairs of ribs. Asterisk true ribs, 1 to 7 directly attached to sternum by costal cartilage. Asterisk false ribs, 8 to 10 attached to 7th ribs cartilage, indirect. Asterisk floating ribs, 11 to 12 no anterior attachment. The appendicular skeleton, 126 bones. Limbs and girdles. 1. Pectoral girdle, shoulder girdle. Clavicle, collarbone, X2. Scapula, shoulder blade, X2. 2. Upper limb, 30 bones per arm equals 60 total. Humerus, upper arm. Radius plus ulna, forearm. 8 carpals, wrist. 5 metacarpals, palm. 14 phalanges, fingers, 3 per finger, 2 per thumb. 3. Pelvic girdle, hip. 2 hip bones, coxal bones, each formed by fusion of ILIUM plus ISCHIUM plus pubis. Together with sacrum equals pelvis. Male versus female pelvis. Female pelvis is wider, shallower, with larger pelvic outlet, adapted for childbirth. 4. Lower limb, 30 bones per leg equals 60 total. Femur, thigh, longest and strongest bone in body. Patella, kneecap, sesamoid bone. Tibia, shin, plus fibula, lateral. 7 tarsals, ankle, including calcaneus/heel and talus. 5 metatarsals, foot. 14 phalanges, toes. Joints, articulations. Joints are where 2 or more bones meet. Classification by structure. 1. Fibrous joints, bones connected by fibrous tissue, little/no movement, e.g., sutures of skull. 2. Cartilaginous joints, bones connected by cartilage, slight movement, e.g., intervertebral discs, pubic symphysis. 3. Synovial joints, most common, have a synovial cavity filled with synovial fluid, lubricant, most movable. Types of synovial joints. Hinge joint, movement in one plane, flexion/extension, e.g., elbow, knee, ankle. Ball and socket joint, greatest range of motion, e.g., hip, shoulder. Pivot joint, rotation, e.g., atlas axis, neck rotation, radio ulnar joint. Saddle joint, 2 saddle-shaped surfaces, e.g., carpometacarpal joint of thumb. Gliding or plane joint, flat surfaces slide over each other, e.g., between carpals, between vertebrae, facet joints. Condyloid ellipsoidal joint, e.g., wrist, radiocarpal joint, flexion/extension plus adduction/abduction but not rotation. Exercise and bone health. Weight-bearing exercise, running, football, basketball, jumping stresses bone, stimulates osteoblast, bone-forming cells, increases bone density, stronger bones. Swimming and cycling, excellent cardiovascular exercise but non weight-bearing, less impact on bone density. Osteoporosis, reduced bone density, more common in postmenopausal women, prevented by calcium intake plus weight-bearing exercise from youth. In Nigeria, the calcium in traditional foods, egusi, pumpkin seed, crayfish, ogu, pumpkin leaf, and dairy products are important for bone health. Common bone injuries in sport. 1. Fracture, break in bone. Types. Closed, simple bone breaks without breaking skin. Open, compound bone pierces through skin, high infection risk. Stress fracture, repeated microtrauma, common in distance runners and footballers. Green stick, incomplete break, in children, flexible bones. 2. Dislocation, bone ends forced out of joint, e.g., shoulder, knee. 3. Sprain, ligament tear at a joint, not bone injury, but related to skeletal system. Nigerian context. Sports injuries in Nigeria, common in football, Niger's most popular sport, knee injuries, ACL, PCL, ankle fractures, basketball, finger fractures, ankle sprains, long jump and high jump, stress fractures. Nigerian football players, many Nigerian professional footballers, e.g., Victor Osimhen, Kelechi Iheanacho, Asisat Oshoala, have physical training programs focused on bone and muscle health. Bone health in Nigerian children. Calcium deficiency is a concern in some rural communities. Rickets, softening of bones due to vitamin D deficiency, occurs in some northern Nigerian children. Limited sunlight, poor diet. WAEC exam tips. 1. 206 bones in adult skeleton. Babies have 270-300, many fuse. 2. Functions of skeleton: support, protection, skull equals brain, ribcage equals heart plus lungs, spine equals spinal cord, movement, levers, blood cell production, red marrow, mineral storage, calcium 99%, energy storage, yellow marrow. 3. Types of bones: long, femur, humerus, short, carpals, tarsals, flat, skull, sternum, ribs, scapula, irregular vertebrae, sesamoid, patella. 4. Bone structure: epiphysis, diaphysis, medullary cavity, periosteum, compact bone, spongy bone, epiphyseal plate. 5. Axial skeleton: 80 bone skull, 22, plus vertebral column, 26, plus ribcage, 25, appendicular skeleton, 126 bones limbs plus girdles. 6. Vertebral column: cervical, 7, thoracic, 12, lumbar, 5, sacrum, 5 fused, coccyx, 4 fused. 7. Types of synovial joints: hinge, elbow, knee, ankle, ball and socket, hip, shoulder, pivot, atlas axis, saddle, thumb CMC, gliding, carpals. Summary. Skeleton: 206 bones, support, protection, movement, blood cell production, mineral storage. Types: long, short, flat, irregular, sesamoid. Structure: epiphysis, diaphysis, periosteum, compact bone, spongy bone. Axial: 80 skull plus vertebral column plus ribcage, appendicular, 126 limbs plus girdles. Joints: fibrous, skull sutures, cartilaginous, intervertebral discs, synovial, most movable. Synovial types: hinge, ball and socket, pivot, saddle, gliding, condyloid. Exercise builds bone density, weight bearing is most effective. Powered by Lightech Academy. academy.lightech.com.ng. NERDC-approved SS1 Physical Education.